Clinical governance in the UK has been defined as a system through which NHS organisations are accountable for continuously improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence in clinical care will flourish. Clinical staff working for the GHA are required to be registered with the Gibraltar Medical Registration Board and also registered and regulated by their respective professional bodies. The government states that in the last year, a handful of GHA clinical staff have been reported to a professional body for a broad range of issues, from a complaint submitted by a patient to issues with clinical standards of practice. These professional bodies, it says, are in the position to determine whether their own standards have been upheld in specific cases or whether they have not. It adds the whole objective of the process is to sustain and improve standards of patient care in the best interest of staff and service users. A government statement goes on to say that in those cases where an individual registered with one of those professional bodies may be involved in a police investigation, it's advised and encouraged that they report this fact to their professional body, as much for support and advice as for regulation. It claims clinical standards of practice are applied equally to all clinicians, irrespective of their grade or seniority, and that there is no question of the application of rigorous clinical governance being designed or employed to punish GHA workers. As Minister for Industrial Relations, Fabian Picardo says he's been working very well with Unite on a number of issues in respect of their health branch. He says he represents the taxpayer, the patients and the ordinary Gibraltarian, as well as the members of the union who have today taken this action. Mr Picardo adds they can't always agree on everything, saying there's a need for an objective and proper standard of clinical governance. He says he hears the concerns of the union and is ready and willing to engage on those concerns at the earliest opportunity, as he has on all other matters. Expressing optimism, he says that despite initial disagreement, with constructive engagement, they can get to positive conclusions which are in the common interest of all in the community. He adds he looks forward to doing so in respect of these concerns also, as they have on many other thorny matters in the past.